Point 3. Complete the sentence. A 39-year-old man presents with a history of insidious abdominal distension over a period of 6 months. Blindness may be caused by vitamin A deficiency. The bleeding and purpura are caused by abnormal platelets function. The white cell count is normal, so we can exclude acute leukemia. The yellow color of her skin and conjunctiva is probably due to PA, pernicious anemia. There was a palpable mass in the right upper quadrant of the abdomen. Treatment is aimed at restoring fluid balance with adequate intravenous fluids. The anemia may be due to increased red cell breakdown. Number 4. Complete the conversation. Professor, what is against the diagnosis of pernicious anemia on physical examination? The problem started quite suddenly, so it didn't have the typical neurological symptoms. He doesn't have any skin pallor, and he doesn't have symmetrical paresthesia or absent vibration sense, and I couldn't feel his spleen. What about his tongue? His tongue was normal and not inflamed or sore. Chapter 16.1. Label the diagram using words from the box. Number 1, skull. Jawbone. Number 3, spine. Number 4, breastbone. Number 5, rib. Number 6, collarbone. Number 8, shoulder blade. Number 7, shoulder blade. Number 8, thigh bone. 9, kneecap. 10, shin bone. Point 2. Match the types of fracture with the descriptions. Number 1, open with letter A. There is a break in the skin. Number 2, community with letter C. The bone is broken into several pieces. Number 4, green stick with a letter B. The bone is bent. It occurs mainly in children. And number 5, impact with letter E. The broken pieces are pushed together. Point 3. Complete the textbook. Reducing a fracture involves trying to return the bones to as near to their original position as possible. If a fracture is allowed to heal in a displaced position, the fracture will unite, but it may go on to malunion. Next chapter. Chapter 17. Complete the table with words from A and C opposite. Then complete the sentence with words from the table. Verb, nouns, and adjectives. Delete, 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 develop, development, develop, distant, distension, distant, fail, failure, failed, nourish, nourishment, nourished. Babies with the fetal alcohol syndrome may present with failure to thrive. Abdominal distension may be due to an enlarged liver. Small amounts of alcohol in pregnancy can affect fetal development. Mortality from measles can be reduced by better nourishment. Delay in one or more of the milestone may be the first sign of this. Point 2. Complete the sentence. After sitting, babies learn to crawl and then to walk. A child who has started eating solid food has been weaned. Someone who is not very tall is said to be of short stature. The stage in a child's development are known as the milestones. A child who is beginning to develop sexually has reached puberty. Point 3. Write common English name for each BC using your medical knowledge. Enlarged parotid glands, MUPS. Difficulty opening the mouth. Lockjaw. Rash and enlarged posterior occipital nodes. German measles. Paroxysmal cough with vomiting. Whooping cough. Papules and vesicles first on track. Chicken pox. Cough and cold followed by rash. Measles. Sore throat and rash. Scarlet fever. Swollen joints and a heart murmur. Rheumatic fever. Fever followed by muscles weakness. Polio. Cough with stridor. Croup. Next chapter. Chapter 18. Complete the table with words from A, B, and C opposite and related forms. Verb and noun. Verb inhibit. Noun inhibition. Reduce, reduction. Release, release. Replace, replacement. Secret, secretion. Secret, secretion. Stimulate, stimulation. Point 2. Complete the passage from a textbook using the illustration and your own knowledge. Schools of GnRH, gonadotropin releasing hormone, are released from the hypothalamus and triggers LH and FSH. Secret from the pituitary, LH stimulates testosterone, production from living cells of the testes. Testosterone feeds back on the hypothalamus pituitary to inhibit GnRH secretion. FSH stimulates the Sertoli cells. Sertoli cells in the seminiferous tubules to release major sperm and the inhibins A and B. Inhibin causes feedback on the pituitary to decrease FSH secretion. Complete the sentence. Look A and C opposite to help you. Diffuse. A diffuse change affects many parts of an organ or gland. A localized change affects only one part. His diet is deficient in iron. He doesn't get enough iron. Hormones T3 and T4 increase the basal metabolic rate. Point 4. Match Mr. David's symptoms with the questions her doctor asked. Diarrhea. Are your bowels normal? Eating more. What is your appetite like? Heat intolerance. Do you prefer hot water or cold? Obesity. Are you able to sit and relax? Palpitations. Have you ever felt your heart beating rapidly or irregular? Weight loss. Is your weight steady? Tremor. Do your hands shake? Next chapter. Chapter 19. Complete the table with words from the opposite and related forms. Verb, noun, and adjective. Accommodate, accommodation. Constrict, constrict. Constriction, constrict. Converge, convergence. Dilate, dilatation. Dilation, and delayed or dilated. Dripping. Oscillate, oscillation. React, reaction. Point 2. Match the pictures with the conditions. Picture 1 with condition squint. Picture 2, irregular people. Picture 3, delayed pupils. Picture 4, constrict pupils. Picture 5, cataract. Picture 6, dripping of lids. Point 3. Complete the extract from a textbook. Retinoscopy. Examine the retina with an ophthalmoscope, if possible, with the pupils dilated to obtain the maximum view. Look for papilledema and for flame-shaped hemorrhages and cottonwood exudes. Assess the state of the arteries and note the presence of any narrowing as well as nipping at arteriovenous crossings. Next chapter. Chapter 20. Complete the case report. Case 14. Physical examination revealed a thin girl with slight pallor. She was not obviously dehydrated. The temperature was 38 Celsius grades, pulse 100 per minute, blood pressure 110 18. Examination of the rest of the cardiovascular and respiratory system was normal. The abdomen was not distended. There was generalized tenderness, which was most marked in the right lower quadrant and was associated with widening, but not rigidity. There was no rebound tenderness and no masses were felt. Vowel sounds were reduced. Point 2. Match the description of the stools with the conditions most likely to cause them using your medical knowledge. Type of stools and condition. Loose, bloody, ulcerative colitis. Loose, pale, pulpy, celiac disease. Clay-colored, obstructive jaundice. Black terry, gastric ulcer. Small heart, irritable bowel syndrome. Clear, watery with mucus. Cholera. Point 3. Match the features on the doctor's questions. Blood. Have you passed black stools? Bowel habit. How often do you open your bowels? Change in bowel habit. Are you going to the toilet more often than normal? Bulk. Is the size or the amount of the stools normal? Color. What about the appearance of the stools? Consistency. Are the motions hard or loose? Offensiveness. Do your motions have an unusual smell? Okay, next. 21. Write simple English phrases for each of the medical terms below using your medical knowledge. Hysterectomy, removal of the womb. Menorrhagia, excessive blood loss or heavy periods. Salpingitis, inflammation of the fallopian tubes caused by bacterial infection. Cervical biopsy is a procedure to remove tissue from the cervix to test for abnormal or precancerous condition. Point 2. Read the conversation between the gynecologist and the patient in the opposite and complete the notes about the patient. Menarche, 20 years old. 12 years old. Menstrual cycle, 4 per 30. LMP, 1 per 52 ago. Menorrhagia, no. Dysmenorrhea, no. Discharge a little. Point 3. Now, write the questions that the doctor asked. Look at the opposite to help you. Menarche. How old were you when you started to get them? Menstrual cycle. How long do the periods last usually? LMP. When was your last period? Menorrhagia. Would you say they are light or heavy? Dysmenorrhea. Do you get periods pains? Discharge. Is there any discharge between the periods? Point 4. Complete the case report. One word is needed twice. Okay. A 45-year-old woman had been having prolonged periods lasting for 8 days with the passage of clots for 9 months. There was no bleeding between periods or after intercourse. Her periods were not particularly painful. She had not noticed any hot flushes or night sweats, and her general health had always been good. She had taken the oral contraceptive pill until a year previously, when a copper coil was fitted. She had had a normal pregnancy when she was 25. Now, the last. 23. Complete the table with words from A opposite. Verb and noun. Auscultate, auscultation. Examine, examination. Inspect, inspection. Palpate, palpation. Percuss, percussion. Point 2. Put the steps for examining the heart and circulation in order, according to the 4-stage system. Measure the heart size, percussion. Are there any murmurs? Auscultation. Feel the radial pulse, palpation. Look for clothing, inspection. Locate the apex beat, palpation. Note any trills, palpation. Point 3. A doctor is presenting the case of a 43-year-old woman at a meeting in the cardiology department. On examination, she was pyrexial with a temperature of 38.5. She was short of breath. Her pulse was variable between 100 and 180 and was irregular in time and force. Her blood pressure was 130/80 and her JVP was up 5 centimeters, showing normal movement with respiration. Her peripheral pulse were all present and there was no central or peripheral cyanosis. Her apex beat was displayed to the anterior axillary line, but still in the fifth intercostal space. Her head sounds were very interesting. When she was initially examined, it was noted that she had systolic and pansystolic and mid-dystolic murmurs, heard best at the apex. When she was examined some hours later, there was a harsh pericardial friction rubs all over the pericardium. Our diagnosis at the time was of mitral stenosis and incompetence with a recent onset of pericarditis and atrial fibrillation. Thank you.